I approach patients the way I would want to be approached as a patient. I approach with compassion, with patience, understanding, and knowledge. So I want patients to come and talk to me not only about what's going on urologically, but other aspects of their lives which often will impact on their urologic health. I don't approach patients as a surgeon or as a pill pusher. I approach them as a human being, and I will often discuss with them behavioral things, diet, exercise, because those all play into what will make somebody healthy and feel good. A patient would want to work with me because I partner with the patient and we discuss what their needs are, and my goal is to help them make themselves better. I offer as many different options for intervention as possible, but mostly what I do is I offer information so that we have a collaborative relationship. I offer behavior modification, medication, and surgical intervention if it's necessary, but I like to keep patients out of the operating room as much as possible. So as a surgeon, I try not to operate, so that if it is a recommendation and it's something that a patient needs, it's because they really need it. My goal is to make the patient better, and we do that as a team. We make new patients feel comfortable when they come into our office by greeting them warmly. Our staff is accessible, warm, and friendly. Our office is clean, it's bright. We like to welcome our patients with a nice office. We take insurance as much as we possibly can, and we work with patients financially. When I see patients for the first time, I want to make them feel comfortable by seeing them in a room with their clothes on so that they feel that they can communicate with me about some of the most personal aspects of their lives. Many of the people that come to see us will see us for conditions that they have had for years but have not felt comfortable approaching a physician about. And we recognize that, we understand that. We want to provide an environment that patients will feel safe in so that they can talk to us about those most personal conditions for which they seek help. The reason that I wrote a book called To Seat on the Aisle, Please, is that I wanted to give women the tools to advocate for themselves. During my training, I was often shocked and dismayed at the way women were treated, and I wanted them to have some information before they went to see a physician about their condition, about their bodies, about how their bodies work, about what their problem was, so that they would be able to advocate for themselves. And I think that the book will provide the information that women will need before they go and see a specialist. The reason that I chose to go into urology was when I was a fourth-year medical student. I did a rotation in urology, and I realized at that time that very few women had chosen the field of urology. And that's when I decided I think this would be a great field for me to go into so that I could focus on women's health. The qualities that go into being a good urologist, in my opinion, are the following. One is being well-trained. So a good urologist is well-trained. Number two is having a special interest in the field of urology that I'm focused on. So I particularly am interested in women's health, which makes me good at treating women. And thirdly is that I'm female, and I have a sensitivity to the field that I practice because of my gender. So the three things that I think go into being a good woman urologist who treats women is being well-trained, being interested in helping women, and finally, being a woman myself. I've been in practice for about 20 years, and when I chose to open my own practice, one of the elements that I wanted to include in that was having women physicians. And the reason that I wanted to work in an all-women's practice is because I feel like I want to be a haven for women doctors, and we're good to each other, we treat each other well, the demands of being a woman physician are unique. And secondly is because we treat women patients, and both men and women, but in our field in particular, patients are interested in seeing women doctors. So if I'm not available, one of my partners is available and she's female, and same with them. So I felt that being an all-female practice is not only a haven for women physicians, but it's also a safe place for our patients.